Hello, I'm Dr. Mark Lindholm, and this is Stephanie Price, and she's 37 weeks pregnant, and we've been treating Stephanie through her pregnancy, and today we're going to demonstrate a little bit about what a visit would be like where I'm doing the Webster Technique, which is a chiropractic technique that we're utilizing with Stephanie. Okay, so I'm going to have you stand up for me, and first I just want to show that pregnant women, even at 9 months pregnant, can still lay on their stomach. This particular table drops down, and we can manipulate the table to make lots of room for the baby and for to make the pregnant woman comfortable. Okay, so I'm going to have you go and slip your glasses off and lay in your stomach. Does that feel okay?
Feels great.
Okay, all right, good. And what we're doing is, Stephanie's been an ongoing patient, so today was just be a regular visit. So we've already previously done a more thorough exam, but today we're checking her progress, seeing how she's doing. She actually was just reporting to me that she's doing really well, other than a little bit of round ligament pain and some very mild kind of pelvic symptoms that she's having. She's not really currently having any problems, so we're going to be checking her. What I'm checking for is the alignment of the pelvis and the spine to, and our goal is to reduce irritation to the nerves that come through the spine and the pelvic area. Specifically, in her case with the Webster Technique, to remove any nerve interference that could affect the nerve supply going to the uterus, to the cervix, that could affect a torsion or a tightness of the uterine muscles, which can cause what's called a uterine constraint, which can make it difficult for the baby to move into an optimal birthing position. In addition to that, just the physical misalignment of the pelvis, if that's the case, can actually cause a torsion on the soft tissues as far as the ligaments that attach from the pelvis into the uterus and the cervix, and also literally just affect the position of the birth canal because of the change of the position of the pelvic bones. Okay, so what I'm doing is just feeling her pelvis and her spine and feeling for the alignment and also how those joints are moving. If there's a problem, or what we call subluxation, there tends to be a restriction in movement, and I'll feel a change in the muscles and the soft tissues. Is that tender when I touch there at all?
Slightly.
And how about here?
Just a little bit more on the left.
And it can vary, but the most common area we find problems with related to the Webster Technique is in the sacrum and the sacroiliac joints, where the pelvis and the sacrum come together. And also a common area is right around L3. So I'm going to do an adjustment, and there's different ways to do an adjustment with the Webster Technique. I'm going to use with Stephanie a drop piece, where I'm going to bring the table up, and then when I go to do the adjustment, this drop piece is going to drop down just slightly, and that allows me to be able to shift the pelvis and the spine in order to open up the space where the nerves come out and remove that nerve irritation. So we're going to adjust her left sacroiliac joint here first. And then for this one, I have you taking a deep breath and then blow it. And then what I'm doing immediately after adjusting her is basically checking what I've just done and seeing if that joint is moving better and positioned better. And I'm going to do a little more on the left side here. With all of my patients, but especially with pregnant women, we want to start off doing as little as necessary and then doing more if we need to. Also, as part of the Webster Technique, it's not uncommon that we do some soft tissue work on the muscles around the areas I just previously mentioned, and sometimes we'll do a release or pressure over some of the ligaments that attach into the uterus and the cervix area, depending on the patient. Like today, right now, I don't know if you can feel that, but I can feel some tightness of the muscles right there.
Yep.
Just a little more in this area. Have you taken another deep, let me get that step here. Taking another deep breath. I'm doing here is one of the clues we can get as to the position of the pelvis is not only what I'm palpating or feeling with my hands, but I was comparing the length of her legs. We're doing a heel check, and also looking at the angle of how her legs are sitting. If one leg, for example, is toed out or toed in, it helps give me some clues as to how her pelvis is aligned. And actually, hers looks really pretty good right now after adjusting her. And then this isn't strictly speaking part of the Webster technique, but every time that I see Stephanie, I check her entire spine. The overall idea of what I do as a chiropractor is try to remove interference to the nerves so that the body can function the way it's designed or function better. And then just here also, maybe taking a deep breath. And then blow it. Can you feel that as it comes out? Once more, take another deep breath. Okay, great. All right, and then I'm going to have you come over in the chair and I'll check your neck also. And we're going to check Stephanie's neck also. The neck just overall is the most important area in the spine in general because all of the nerves have to come back and forth through the neck to communicate with the brain, and so it has a bigger effect on your overall function of your body. There also is a connection between the upper cervical part of the spine and your organ function, so it's an important area to check all the time, but especially during pregnancy. And if you turn this, feels like it's a little clear right there. Is that, you feel that on the left side? In her particular case, I'm just finding one spot in her neck that feels like it needs to be adjusted. So I'm going to bring your hip over to the left here. Just like that. Okay, great. And that's kind of the extent of her adjustment. And what I thought I'd do is just ask you, Stephanie, if you don't mind, is just to say a little bit about your experience of, if you don't mind, about how you ended up coming to the office, or maybe what your experience has been in during this pregnancy.
I was referred to chiropractic care with my last baby, who was born almost 5 years ago, and she was having an unstable lie, which means she was breached some of the time and kind of bouncing back and forth, and came to see Dr. Lindholm, and he took a look at my spine and saw that I did in fact have some significant subluxation in my pelvis, my sacrum, my lower back, and he adjusted it and continued to adjust it probably weekly for several weeks. The baby turned, and I had a very great anterior vaginal birth after delivery. So I knew that for this pregnancy, chiropractic care would be part of the preventative planning and preparation for good fetal positioning. You want babies to be head down and with their backs largely towards the mother's front, and that is an ideal position for birthing. And I found chiropractic care just seems to open up and make the pelvis more roomy as it's intended.
Right. So. Great. All right. Well, thank you very much for sharing with us.